Hello, I'm Dr. Ng. I'm a developmental behavioral pediatrician with Potomac Psychiatry. Thank you for taking the time to listen to my presentation on the management of autism. I'll be providing some insight regarding what steps parents should consider once they receive a diagnosis of autism for their child. This presentation is part of a series, so I encourage you to watch the others that are focused on more specific topics such as medications for ADHD or anxiety or nutritional recommendations. These presentations can provide some valuable information to help families decide what treatments are available for their children. In the interest of transparency, I would like to take the time to disclose I have no financial interest with any pharmaceutical company, supplement producer, or medical testing company. This presentation is for general purposes only, and not everything discussed may apply to your child. Parents are encouraged to discuss these topics with their pediatrician. My presentation today will provide an overview of these topics. I know there are many items to consider after a family receives a diagnosis, so feel free to watch the parts of the presentation most relevant to your situation. As you can see from the list, managing a patient with autism is complicated and often requires an experienced clinician to assist parents. Parents should seek out an expert to help guide them through the process if they have any questions. I would like to start with some background on autism. At the time of this presentation, the prevalence of autism is about 1 in 36 children up to age 8 years old per the CDC Autism and Developmental Disabilities Monitoring Network. Boys are affected 4 times as much as girls. For boys, the ratio is approximately 43 per 1,000 patients, which means 1 in 23 boys may be affected by autism. That translates to be approximately 4% of boys may be on the spectrum. For girls, the ratio is 11.4 per 1,000 individuals, and that translates to 1 out of 87 girls. Based on this trend, we can expect more children to be identified as neurodiverse in the future. Autism is a neurodiverse condition where an individual may exhibit differences in social engagement and present with restrictive, repetitive behaviors. This is the Diagnostic and Statistical Manual of Mental Disorders 5th edition criteria that is used to help make a diagnosis. I think it is important to understand some of the core symptoms to better understand what therapies and treatments will seek to address. As you can see on the slide, criteria A symptoms focus on the back and forth aspects of social interaction. A core symptom of autism is the difference between nonverbal communication and eye contact between typical and atypical patients, and development of, and as well as maintenance of relationships with others. The presentation of criteria B symptoms can vary significantly and involves restrictive or repetitive behaviors. Some common behaviors that fall into this criteria include stereotypies, such as hand flapping or producing a sound repetitively. Inflexibility or rigidity are among the more problematic behaviors observed, such as only eating a specific brand of food or insisting parents take a particular route to a place. Patients with autism also may exhibit restricted interests, such as memorizing different types of dinosaurs or being fascinated with wheels. Lastly, patients may exhibit hypersensitivities to certain stimuli, such as not tolerating being wet, or engage in sensory-seeking behaviors, such as pinching parents to self-soothe. A specific patient's presentation may differ significantly from others, and this will determine which interventions to prioritize. The remaining criteria are listed here in the interest of being complete, but are mainly conceptual points for clinicians to differentiate autism from other conditions when trying to arrive at a specific diagnosis. You can pause the talk to read it if you are interested in knowing more. I'll be moving on to the main topics in the interest of time. So you've received a diagnosis of autism for your child. What do you do next? For many families, they may feel overwhelmed at first and experience many different emotions, such as fear of their child's future, guilt, anger at the situation, or sadness. It is difficult to plan while coping with these strong feelings. Parents may not always understand everything medical providers are trying to explain, and it is difficult to listen to a physician, let alone enact a plan of action when your mind is racing. I make the analogy, it's like being confused at the beach. You're trying to figure out what to do, but waves of emotion keep crashing over you. It can often be difficult to keep yourself afloat, let alone think clearly. I advise parents to take the time to process their feelings. Remember, it is perfectly fine to feel whatever emotions you have and try not to suppress them or ignore them. Once you feel you're emotionally ready to coordinate a plan of action, then start to ask questions. The first piece of advice is that parents should always make self-care a priority. Think of an airplane. If the oxygen mask drops down, then you are supposed to put on your mask before helping your child because you could lose consciousness. If you don't take care of yourself, then you run the risk of falling victim to the stress of caring for a child with special needs. If you can't function, then you can't help. This can be as simple as recognizing where you are emotionally, how much charge you have in your battery, and what you will need to do periodically to recharge. I cannot stress this point enough. And while doctors may be experts in medicine, parents are experts in their children. So the second thing I recommend is to understand what deficits or behaviors are the most problematic in your situation. This will allow you to set up your priorities for treatment. Generally speaking, I recommend addressing any self-injurious behaviors as a primary priority. Other issues to prioritize include speech delays, especially for young children. Problematic eating behaviors are also a priority that may require interventions such as feeding therapy. Make a list for yourself and discuss what services you can get from where and when. Once you have the priorities identified, which ones are going to be difficult to obtain are the ones to prioritize. I borrow a term from chemistry and call these rate-limiting steps. This is often the result of a supply-demand mismatch that results in wait lists. Call your insurance company for a list of approved vendors for the various therapies and then get your child's name on the list so you can work concurrently on other problems as you wait for your turn. Since some services may have wait lists that are months long, you will likely have time to compare which therapy providers fit your situation the best. Another thing to consider is that having a diagnosis isn't always the end of the evaluation, and you may need to see other specialists as well to get more testing. We will read this over the next couple slides. For most patients, the priority is to get your child ABA therapy. Early intervention has consistently shown to improve a patient's prognosis. ABA therapy is likely the most common treatment available for patients diagnosed with autism and has a robust amount of literature to support its effectiveness. ABA is ideally started as early as possible and effective from ages 2 to 6. This therapy works to develop desirable behaviors and minimize problematic ones. It can reduce aggressive behaviors, develop social skills, and improve communication. This therapy is available to commercial organizations in various settings such as center-based or home-based. Center-based is often similar to being in a preschool and offers more hours of ABA a week, and occasionally offers other therapies that are on-site. The drawback of center-based is that it may conflict with your schedule with your local school program. Home-based programs allow your child to learn practical skills for home that improve their activities of daily living, but typically offer less hours a week. Home-based programs can also complement school-based programs, which is another consideration, and allows patients to have both the social experience of school while focusing on building up self-help skills at home. For young children, ABA can employ strategies such as discrete trials to improve a patient's behavior. School programs are also ABA-based. ABA is covered by most insurance plans. Parents often ask about alternatives to ABA, so I thought it worthwhile to mention some other therapies that are used to treat the core symptoms of autism. PRT is another therapy that was developed by Drs. Robert and Lynn Cagle at Stanford University. It is an empirical supported treatment for autism and is a naturalistic form of ABA. It's typically performed in one-on-one sessions. The focus of each session changes as the person makes progress to accommodate more advanced goals and needs. This type of therapy is child-directed. PRT programs usually involve 25 or more hours per week. Since it is a form of ABA, it may be reimbursed by some insurances, but you have to consult with your plan for details. An alternative therapy to ABA is floor time. Floor time was created by child psychiatrist Stanley Greenspan and Serena Wider. It is based on the Developmental Individual Differences Relationship-Based Model, DIR. Dr. Greenspan developed the DIR model as a therapy for children with a variety of developmental delays and issues in the 1980s. Floor time is a relationship-based therapy for children with autism. The intervention is called floor time because the therapists get down on the floor with the child to play and interact with them at their level. Children typically lead the interactions while the therapists increase the complexity as they go along. Unfortunately, both of these treatments may not be as readily available as ABA, so please consult with your pediatrician to see what they know is in your area. Most children with autism require additional therapies to ABA. Deficits in communication are one of the core features of autism, and patients will often need speech-language therapy. Speech therapy teaches patients how to understand others, speak in a socially appropriate manner, incorporate gestures into their interactions, and use body language to enhance their speech. Fortunately, speech therapy is often offered by early intervention and schools, which makes it easier to obtain. One consideration to note is that some speech-language pathologists can teach patients how to use an augmentative and alternative communication or AAC device. An AAC device may be a program on a tablet that assists your child with communication. Using an AAC device for aided communication is considered evidence-based practice, and some insurance plans will cover such a device. This should be a consideration for parents with nonverbal children when choosing a provider for speech therapy. Occupational therapy is another common form of treatment for children with autism. OT typically works on improving fine motor skills. There are differences between OT services offered privately versus that of school. Commercial insurances usually reimburse for therapy that address self-help skills at home, such as getting dressed or eating independently. Insurance plans will typically not cover services for poor handwriting or using a scissor. Deficits related to schoolwork, such as those typically provided by schools, are covered by the educational system. Conversely, schools may not always help with self-help skills such as feeding or dressing independently. This is why patients may require OT both privately and at school. Physical therapy may be necessary for children that have some issues with big muscle groups or coordinated movements, such as walking or jumping. Examples would be a child that tiptoe walks to the point where their calves become hypertonic and require regular stretching. This therapy is recommended for any child that has difficulty with core strength or motor delays that affect their daily lives, such as not being able to get up or down from a bed. Eating issues are common in children with autism and often have a major impact on the daily lives of parents. Struggling to get a child to eat 3 times a day can be very stressful, which is why feeding therapy should be considered for patients with eating disorders. Poor oral motor tone is also common in nonverbal children that do not practice making complex sounds daily, and feeding therapy might be provided for speech pathologists, by speech pathologists. Challenging eating behaviors may present in different ways, such as refusing to chew food and trying to swallow it whole, or being averse to certain textures, such as crunchy foods. Feeding therapy can minimize some of these behaviors by building up oral motor strength and coordination, as well as desensitizing patients to certain food textures. This therapy is not usually provided in schools, so parents should consider this point if scheduling after school becomes an issue. Julie Went is a licensed clinical nutritionist with Potomac Psychiatry, and she has produced 2 separate talks about nutrition and feeding strategies in autistic patients. I recommend you view those talks if you want to learn more about those subjects. Now we are going to move on to early intervention and special education services. These services can be provided by state-funded programs that can vary significantly between counties. Some areas offer special education placement early, and in patients with regression, services can extend into summer months. This is a major consideration when deciding which services to pursue through a patient's insurance. There are only so many hours in a day and days in a week. A special education program may restrict the number of available hours after school for private therapy. This is why parents should consider what services we offer through early intervention and special education, and pursue the therapies through insurance that are not already offered. When deciding class placement, school districts will adhere to the principle of least restrictive environment. This means setting closest to general education that still provides an appropriate education. To determine the appropriate placement for a student, schools will use a calculation based on the number of hours a student will be removed from general education for services such as speech or occupational therapy. This is to ensure the student can be in the least restrictive environment. If the student requires services that limit general education class time to less than 40%, then the student will typically be placed in a self-contained class. Parents should play an active part in developing an individualized education program. Here is a list of some common services and accommodations to consider when meeting with the Special Education Committee. Lastly, if a student has a specific healthcare need, then families should meet with the school nurse to develop an individual health plan when appropriate. Caring for a child with autism is often complicated, and parents may require the guidance of multiple medical specialists. I would like to discuss some of the more common consultations that parents should consider. This list is not meant to be exhaustive, and families should consult with their pediatrician for recommendations specific for their child. Full transparency, I am a developmental behavioral pediatrician, and I may be slightly biased about my first recommendation. Developmental behavioral pediatricians specialize in the diagnosis and management of autism, which makes us a valuable consultation. Developmental pediatricians receive a training in medical, academic, and legal aspects of care for an autistic patient. We are also able to identify and manage conditions that occur along with autism, such as learning disabilities, ADHD, anxiety, and motor tics, to name a few. Developmental pediatricians often act as a point person to develop a comprehensive plan to manage autism effectively. Developmental pediatricians can advocate for families and should be consulted when possible. Unfortunately, the number of developmental pediatricians is limited nationwide, so waitlists to see one are not uncommon. Speak with your pediatrician about a referral for your case. Child and adolescent psychiatrists are physicians specially trained to assess and diagnose and treat children with mental health conditions. Autistic patients are at higher risk for mental health conditions, and parents should consider a referral for an assessment when their concerns are related to a patient's mood. Child psychiatrists can often provide cognitive behavior therapy in addition to prescribing medications. Many are also able to manage teens as they age into adulthood, making them a source of stability when transitioning patients from pediatric to adult practices. Children with autism are at high risk for having a neurological condition such as epilepsy. Parents that observe any of these signs above should bring their child to an emergency room for an evaluation. For mild symptoms that are unclear, recording them may be helpful to show a physician. Parents should have a low threshold to request an evaluation by a pediatric neurologist since certain types of epilepsy are not obvious. Neurologists may order an EEG or MRI to assess whether a patient has a neurological condition. Unfortunately, many patients who receive a diagnosis of autism do not receive genetic testing, even though children with autism are at high risk for genetic conditions. An experienced geneticist can guide families about which tests are indicated and provide counseling based on the results. I encourage parents to request referrals from their primary care physicians. This is not an immediate concern initially, but families can discover a potential cause. Another reason is for planning purposes. These tests can guide health monitoring in the future. For example, certain disorders have a high risk for cancer. Awareness of a genetic condition will also allow family members to request testing for themselves if necessary. Genetic tests are recommended by the American Academy of Pediatrics, the American Academy of Neurology, and the American College of Medical Genetics and Genomics. In a 2020 study of 500 patients with autism, about 12% had pathologic findings. There are no significant differences in developmental tests, language tests, or motor tests between the patients with normal results versus variants of unknown significance versus pathogenic findings. This means that all patients with a diagnosis of autism should receive testing, regardless of their clinical presentation, since this is not a reliable way to determine the yield of the test. The chromosome microarray is the standard test recommended for all patients and typically covered by insurance plans. Fragile X testing is also recommended for boys. Many women may have had Fragile X testing during their prenatal care, so please consult your OBGYN to be sure. The yield of a microarray to find a genetic variation can be up to 10% and about 1 to 5% in Fragile X. Exome sequencing is a more detailed test and may find a potential cause for autism in up to 30% of patients. And it could be recommended by your geneticist, but you need to contact them to see. Certain tests, like for the P10 gene, is related to a condition that's associated with autism. P10 is a tumor suppressor gene and has been associated with autism and microcephaly, or having a bigger head. Rett syndrome also occurs in autism, and it occurs mostly in girls. It should be suspected that a female patient exhibits core symptoms such as regression of language or loss of purposeful hand movements. Parents can consider some additional testing that can provide some helpful insight. Intellex DNA offers some genomic testing which studies the small variations in a person's DNA and how that affects our health. They provide an evidence-based clinical decision support tool that references social studies, scientific studies to explain a possible impact on a patient's particular genetic profile. Genomind is another test to consider. It examines the genes related to how medicines are metabolized, as well as how they may affect the patient based on their genetic profile. This test is helpful when deciding which medicines to consider. Historically, clinicians would use a process of trial and error when choosing medication to treat a condition. Testing such as Genomind provides insight that allows clinicians to make a more informed decision that may increase the chances of success. Folate receptor alpha antibody testing, or FRAT for short, is another test parents should consider. Emerging evidence suggests that children with autism are at high risk for having antibodies that block or blind folate receptors. Folate is vitamin B9 and is an essential nutrient that is used for several processes such as DNA synthesis and the regulation of homocysteine. Dr. Richard Fry has conducted studies that demonstrated that leucovorin can be beneficial in patients with folate receptor alpha antibodies. Treatment of this condition improved language in patients with these antibodies in a randomized double-blind placebo study. Moving on to medical treatments, when considering medications to manage autism, parents should keep in mind there aren't any FDA-approved medications that address the core symptoms of autism, such as nonverbal communication deficits or atypical social interaction. Medications may be prescribed to address specific behaviors and conditions. There are currently only a few FDA-approved medications for specific indications for patients with autism. Second-generation atypical antipsychotics can be beneficial in reducing self-injurious behavior and physical aggression for children. Unfortunately, there are potential side effects such as weight gain, changes in glucose, as well as lipid profiles over time, and a low potential for tardive dyskinesia. Parents should have a thoughtful discussion when considering the benefits and potential side effects. There are other medications that are prescribed for conditions often that occur along with autism, such as stimulants for hyperactivity and SSRIs for anxiety. This talk is a part of a series, and I recommend you watch Dr. Marjorie Johnson's presentation on the treatment of those disorders. Dr. Johnson is a gifted child and adolescent psychiatrist with Potomac Psychiatry and has many years of experience managing complicated cases of ADHD as well as anxiety and depression in children with autism. Physicians will consider off-label use of medications when appropriate. Autistic patients may have sleep disorders, and alpha agonists such as clonidine have been effective treatments. Another example of off-label use is prescribing beta blockers for patients with Smith-Magenis syndrome. Smith-Magenis syndrome is a genetic condition associated with autism, and the patients often have poor sleep patterns. A beta blocker and melatonin led to improvements in their sleep behaviors. Emerging evidence suggests some medications can be effective treatments for autism with specific conditions. As follow to a previous slide, patients with antibodies that block or bind folate receptors demonstrated an improvement in language when prescribed leucovorin. Leucovorin is folinic acid, which is a reduced form of folate, and uses a different mechanism to cross the blood-brain barrier. Leucovorin is safe and used as an antidote to offset the harmful effects of chemotherapy medications. It has an excellent safety profile, and early studies demonstrated significant improvements in language impairment. Fragile X is another genetic condition associated with autism, and patients with that condition were prescribed metformin and demonstrated improvements in their behavior as well as reduction in obesity. Metformin is typically used to treat type 2 diabetes. Metformin appears to be a good candidate for targeting several of the intracellular functions in neurons disrupted in Fragile X syndrome, therefore has the potential to rescue several types of symptoms in affected individuals. Certain supplements have demonstrated potential benefits in autistic patients. Sulforaphane is a phytochemical found in broccoli sprouts. It has been shown to have antioxidant and anti-inflammatory effects. Unfortunately, the exact mechanism of action is unknown, but sulforaphane seems relatively safe and can cause some mild side effects such as abdominal discomfort. L-methylfolate supplementation also has demonstrated benefits in patients with anxiety and depression. It has been used in patients with treatment-resistant depression and seems to be an effective adjunct treatment. Iron supplementation is a potential solution in patients with pica, patients that eat items that lack nutritional value that may have anemia. It is not uncommon for autistic patients to have poor diets that may result in anemia, which is why this should be a consideration. Safety is another important and often overlooked consideration. Autistic children are at higher risk for accidents, and parents should evaluate their situation for appropriate preventative measures. Typically, children between 4 to 6 years old are able to remember their address and parents' phone number. If your child is unable to recall this information reliably, then parents should consider obtaining a medical ID bracelet with this information. Parents can also obtain wristbands with Apple AirTags or Galaxy Smart Tags that can be used to track a child's location if they wear the bands. Making homes safer should be another priority, and parents can purchase safety kits online. The National Autism Association offers a big red safety box that has many safety items inside. You can visit and support them online, and I encourage you to visit their website on the slide. Police departments may have safety plans and programs for autistic children. Parents should consider their local police department to see if they have a program and for more information. I listed the website of Montgomery County, Maryland's outreach program as an example. Lastly, I would like to take a moment to discuss financial consideration. Caring for someone with special needs can be expensive, and I advise families to seek out a financial advisor about options that families can use to plan accordingly. Two items that may be beneficial for families are an ABLE account or a special needs trust. An ABLE account, also known as a 529 ABLE or 529A account, is a tax-free account that families can start for a disabled person. These accounts offer more flexibility than regular 529 and college accounts, since they can be used for a wider variety of reasons, such as transportation, basic living, and housing. The principal investment can grow tax-free. Annual contributions are typically limited to annual gift exemptions and can be made from anyone. Parents should talk to a financial advisor to learn more. Special needs trusts are a financial vehicle that can preserve a family's wealth for their special needs family member without affecting their eligibility for public assistance, such as supplemental security income and Medicaid. The rules vary by state, but most offer a method for parents to gift items to family members in a manner that does not incur a tax liability. This can be useful for large financial assets, such as a home. Parents should contact a lawyer in their state that is familiar with this process to learn more. I'm not a financial advisor, so I recommend families consult with one of these individuals to learn more about their options. In summary, the management of autism is complex and requires expertise in different areas. Parents should seek out appropriate therapies and implement them as soon as possible. One of the main responsibilities of parents is to coordinate care and consult with different specialists. Parents should work with their pediatrician to create a medical home for their child. This presentation was meant to give you a general overview of topics to consider. I hope this talk was informative for you. To learn more about any of the subjects, please feel free to contact our offices, and we will be more than happy to arrange for a consultation. Thank you again for taking the time to watch this talk, and remember to check out the other presentations in this series for more information. Goodbye, and I wish you all the best.